Thank you for joining another episode of MedTalk. Today we are with Dr. Makhija on mental health issues. Dr. Makhija is a founder and president of SAMHIN, South Asian Mental Health Initiative. He is a distinguished life fellow of the American Psychiatric Association and served as the president of New Jersey Psychiatry Association NJPA from 2012 to 2013. He is the recipient of the prestigious Golden Merit Award for his contributions to the NJPA and the Exemplary Psychiatrist Award from the National Alliance on Mental Illness, NAMI. Dr. Makhija practices psychiatry in New Jersey and has a vested interest in the mental health in South Asian community. I am so thankful Dr. Makhija is here today for the wonderful talk. Welcome Dr. Makhija to MedTalk. Thank you for your time to come in today to talk about mental health issues. 21st century with a fast life, many mental health issues in all communities and all walks of life. Why is it important? Mental health is so important, and why the mental health is as important as your physical health?
You know, it is very true. We take it for granted, but mental health is as important as physical health, and there cannot be good health without mental health. In fact, famous psychiatrist Brock Chisholm, he was the first Director General of World Health Organization. He said more than 5 decades ago that there cannot be true physical health without mental health. And since then, we have a lot of evidence to support that assertion. For generations, we have learned that meditation, yoga, and special breathing exercises helps to relax our body. And now we have research to prove that and support this assertion that yes, in fact, there is a connection, there's a two-way relationship between mind and body, the mental health and physical
Correct.
health. I'll give you another example. Mental problems, emotional problems can actually cause real physical symptoms. Here are common examples: headache, palpitations, diarrhea, constipation. Emotional problems can aggravate existing physical problems or even cause physical problems. Mm-hmm. For example, it can increase the blood sugar in diabetic. Mm-hmm. It can raise blood pressure.
Correct.
It can worsen the symptoms of irritable bowel syndrome. We know, primary care physicians from their experience know that some of the patients that come to their office with physical problems end up having psychiatric disorders. In fact, in one study, they showed that 26% of the people coming to primary care office have underlying psychiatric disorders, and about half of them were depression. There's the other flip side to this. Physical problems can present as psychiatric symptoms.
Yes.
For example, cancer can present as depression, and that is even before the cancer has been diagnosed. I'll give you an example of a patient I saw early in my career, in the early 1980s. A young veteran came to me for evaluation and treatment for depression. I evaluated him, but something did not look right. So I sent him to the university for further workup to see what's going on. It turned out he had a pituitary tumor. And he was operated, and about a year and a half later, he came back to say thank you. And he was back in school, no longer depressed, and this is a depression that didn't really needed any psychiatric treatment. So physical problems can present as emotional problems. So there is a two-way relationship between the mind and body. We know that often people with emotional problems may present as physical symptoms, and they go to the primary care office and they undergo extensive workup. Tremendous money is spent, healthcare dollars are spent on these tests and to uncover what is wrong with the person. And especially if the primary care physician is not vigilant about the underlying psychiatric problems, which can be missed, and there is significant delay in seeking the right treatment. So yes, there is in fact a relationship between mind and body, and there cannot be true health without mental health.
Sure. So how good are we addressing our physical and mental health needs? I know on the physician side or for the medical side, we have people goes for regular routine physical examination if they have a back pain or if they have a headache, if they have a dizziness, to make sure that the diabetes and their hypertension is checked. On the mental health side, do we have such a thing, or do you see that people take care of their mental health need on a regular basis?
I think as far as you said, as far as the physical health is concerned, we are pretty good most of the time in taking care of physical needs. But when it comes to mental health, we are not so great with it. I think it is more socially acceptable to talk about physical symptoms, to seek help when something is not right. If somebody has blood pressure, diabetes, you seek attention, get the medicine so it can be under control. If somebody is vomiting for 2 days, or if somebody has a fracture, you rush to the doctor. But someone could be suffering from depression for a few months and sometimes even years before treatment is sought. And it is not unheard of.
So that leads me to a next question. Diabetes, hypertension, cardiovascular disorders, those are common disease. How about the mental health side? What are the common illnesses in mental health side that someone should worry about?
I think anxiety and depression are the two most common illnesses. In fact, most of the diagnoses for which people are treated for mental disorders are not the kind of diagnoses and disorders that you see in flashy headlines. And anxiety and depression can also be part of other psychiatric disorders like bipolar disorder or schizophrenia or attention deficit hyperactivity disorder. Another common disorder is, besides anxiety and depression, we have schizophrenia, which occurs worldwide in about 1% of the population, regardless of which culture, which country you go to. 1 in 4 people suffer from depression. ADHD is another form of psychiatric diagnosis which consists of attention deficit hyperactivity disorder. And here the basic problem is difficulty in focusing attention, and that can have secondary other symptoms like hyperactivity in some people, not everybody. And this often occurs in young children. That's when it's first detected, and they are often seen as being lazy and not doing the work. And about half of these will grow out of it, but other half the symptoms will persist. There's another condition called Obsessive-Compulsive Disorder, in which the person may have irrational thoughts that can be a torture, and they can control these thoughts. For example, the thought may be, there is a knife in the kitchen, I'm going to take it and stab my wife. And this person is not violent, but the thought is so disturbing, they cannot sleep at night. Or they may have compulsive rituals, where they have to intense need to do certain things in a ritualistic manner. For example, they have to wash hands in a certain manner for a certain number of minutes, which in this day and age with coronavirus, it may not be a bad thing, but they go beyond what to wear So for example, if a normal person takes half an hour to get ready, somebody with severe OCD, it may take them 2 hours and they end up going late to work. So it affects their life, their functioning. Another disorder is post-traumatic stress disorder, when someone has had experience of severe trauma, danger to life, or has been assaulted or witnessed somebody being assaulted or killed, can result in lasting symptoms, what we call post-traumatic disorder. So those are some of the common disorders. Bipolar disorder is another one where there are extremes of mood. You can go from extreme high moods of like person is really euphoric as if he has taken drugs without having taken drugs, or they can crash into an extremely severe dark depression which can last for a long time.
So on the medical side, we see some warning signs. Let's say somebody has excessive thirst or excessive urination, he or she may be suffering from diabetes, or if they have a continuous headache, could be migraine, could be hypertension, could be any other vascular disorders. How about mental health side? What are some of the common warning signs people should worry about to seek mental health help?
American Psychiatric Association says that most of the serious mental disorders do not come out of the blue. Most often families, teachers, or others around the individual, and often the individual themselves, sense that something doesn't feel right, or they may have some emotional discomfort before the full-blown illness manifests. So in terms of the warning sign, there are 4 large categories. One is personality changes in the mood, the thinking, behavior, and functioning. So personality changes may consist of the person withdrawing. They lose interest in being with others. They isolate themselves. The person may start behaving in an idiosyncratic manner. There may be peculiar and odd behavior exhibited. They may be intensely preoccupied with unimportant things. The changes in functioning is another significant warning sign. For example, the person may not be functioning as well at work, at school, or at home, or social activities. Person may miss days at work, or when he goes to work may not perform at his optimum level. If they are in school, the grades may drop. The person may start failing when they normally might have excelled. They may start not caring for themselves. For example, their hygiene. They may not take shower for a few days. Or a woman who is normally very meticulously dressed, wearing makeup, suddenly doesn't care how she looks. Those are some of the warning signs that the functioning. In terms of the thinking, you might see problems with the person starts to have difficulty with concentration, or remembering things, memory problems, or the person exhibits paranoid thinking or unusual beliefs, become suspicious, or they are intensely preoccupied with bodily symptoms or diseases, and they keep thinking to the point they'll spend 2 hours of research online trying to figure out while their other important things are suffering. Then the mood changes. The person can be very depressed, apathetic. They may be very sad all the time. They may have crying spells. They may become very angry, hostile, or even sometimes exhibit violent behavior. They may, somebody is talking about suicide or threatening suicide. Those are clear warning signs of mental illness. someone who starts to abuse alcohol or drugs. That's another big major sign of mental illness. Person has significant changes in sleep, appetite or weight. Those are some of the these are some of the broad general symptoms that you look for. Now you don't need all of the symptoms to qualify somebody having a problem, but if they show some of these symptoms, and especially if the functioning is affected, it might be prudent to talk to a professional and get a consultation.
So what I gather from your talk, the mental health issues or diagnosis could be anxiety, depression, schizophrenia, bipolar disorder. What other conditions do you see in your practice for South Asians or people in general in the US?
I think, as I mentioned, anxiety and depression are the two most common. You see schizophrenia, you see substance abuse, alcohol abuse, which is a big one. And in fact, in the past 20 years, there have been more deaths from alcohol. The number of deaths from alcohol-related diseases has doubled, going from 36,000 in 1997 or 1999 to 20 years later to 72,000.
Wow.
So significant increase, and the deaths are due to liver diseases and other alcohol-related. So substance abuse is big, and a lot of times people may not seek help because of the stigma associated or denial, and until there is a consequence, for example, legal difficulty, or getting arrested for drunken driving, or getting into a serious accident, or even death, God forbid, and then the time for hush hush is gone. Then they are forced to seek treatment.
So we'll come back on probably on a different day to discuss substance abuse and alcohol abuse. But in general, why people are reluctant to go seek help on a mental health side? They go to physicians all the time for their regular physical exam. They even go for checkup if they have some symptoms. But why they are reluctant on a mental health side? Is there a stigma? Is there any social reasons? What are the common factors do you see on the mental health side?
I think there are several reasons why people who have emotional difficulties and psychiatric illnesses, mental illnesses, don't seek help. And stigma is one, which is one of the major barriers to help seeking. Shame associated with mental illness. Denial is another one. And often the misperceptions and misgivings about mental illness and the available treatments. And stigma is probably one of the biggest barriers to help seeking. Stigma is actually a Greek word which means a mark of disgrace or a stain. So whenever there is a variation from the norm about the emotional status of the individual or the behavior, it is seen, unfortunately, as a mark of disgrace. When somebody has when somebody has physical problems, it is more socially acceptable to talk about physical problems. But when they have emotional difficulties, when they have anxiety, depression, or these irrational fears of germs or compulsive rituals, people don't want to talk about it, don't want to acknowledge it, don't want to talk about to their close family members, and even to their own doctor. So it goes untreated for a long time. Mark Comrade, he's a psychiatrist and an author in his book called You Need Help, writes that when it comes to physical problems, we talk about illnesses, diseases, sicknesses. But when it comes to our mental lives, other words creeping in to our conversation.
Yes.
Like crazy, wacko, pagal, insane. And these are reflective of the inherent stigma,
Yes.
in our society, which is ubiquitous amongst all parts of society, but I think they are more rampant in our community, South Asian community. Our community, I think, is more acutely conscious of the public image. What will people think? What will people say? And that keeps them from admitting
Yes.
and coming out and seeking the help. The other thing, there may be fear that acknowledging and admitting or seeking help might affect the future alliance for marriage
Yeah.
of a family member. Other misperceptions and misgivings that interfere with help seeking and then delay in seeking help are some people might think that, oh, psychiatric treatments really don't help. Psychological treatments really don't help. It's not a real science. And I tell you, I'm alarmed at how I hear this, not just from lay people. I was at a dinner and I heard from a physician who had been in practice for 25 years and he was the chair of a department, a South Asian. And he, with a straight face, told me psychiatry is not a real science and he doesn't believe in it. The only time he'll refer is because when he cannot figure out anything is wrong with it. So denial is another aspect, another factor that keeps people from seeking help. So denial is not accepting that you have the illness, and this may be conscious when the person is aware of it, or unconscious when the person is not aware of it. It's more commonly unconscious than conscious.
Yeah.
Sometimes people are reluctant to seek help because they are afraid. And that I feel is more, from my experience, I see in our community. The fear that the information may release to the employer. And no matter how much reassurance we give, they are constantly afraid that it will be released. And confidentiality is very sacred in health field, and especially in psychiatry. We protect the information and we don't release it without the written consent of the individual. But there is this constant fear that the information be released to the employer, and they might lose their job, for example.
Right.
So those are some of the things.
So I always have. I'm very curious if someone identify or accept responsibility that okay, they need to get some mental health. What is the next step? What do they do? Is it available to common people? Insurance covers those services. Can you elaborate more on the mental health side?
I just thought of one more point about why people don't seek help. I wanted to tell you about that, then I'll come to this. In our community particularly, we have our unique ways of coming up with solutions. And a couple of things come to my mind. One is we send the person to India. And it is not uncommon. The reasons can vary, and it is not always for treatment. Most of the time it is not for treatment. And there is this fantasy that sending them to India will change things and he'll get better, or they don't have to deal with it. I mean, and the second is, get them married. That will somehow solve problems. Bahu aa jayegi, sab theek ho jayega. And but unfortunately, I tell people marriage doesn't solve problem; it only adds more problems. And the third is that we believe in alternate medicine and complementary medicine, yoga, meditation, Ayurveda, homeopathy, which are all great, and I think they go a long way to help normal stress and emotional problems, and even some mild psychiatric conditions. There is enough data to show that it helps. But when it comes to serious mental illnesses like schizophrenia, bipolar, severe depressions, they might just persist on this alternate medicine and not seek the conventional treatment, and this causes significant delay in treatment.
Especially the acute episodes.
Exactly.
Yeah.
And unfortunately, the longer you wait, the sicker the person gets, and the harder it is to get them out of that. So now let me come back to your question. So when somebody accepts, what do they do? What's the first step? First step is making a proper diagnosis. And in fact, Hippocrates, who's considered like the father of medicine, 3rd century BC, a Greek physician, he said that diagnosis is half the cure. And more recently, another author, psychiatrist and publisher, Dr. Daniel Carlett, said in his book called Unhinged, that during an acute crisis, the person feels that their life is spinning out of control. They are confused. They don't know whether they'll ever feel normal again. And getting an explanation for their experience goes a long way to the cure. So yes, the first step is making a diagnosis, helping the person understand what is going on.
So are there any tests for the medical side? We have a blood test, we can do ultrasound, we can do CT scan, we can do MRI to make a diagnosis for back pain or nerve condition or a diabetes or thyroid problem. What tests are available to diagnose mental health? Is there any test available for mental health?
So the short answer is there is no laboratory test at present that can be done and a diagnosis can be made. Psychiatric diagnosis is still the old-fashioned traditional way. We have two tools. One is the psychiatric interview of the person, and second is direct observation of the person, which was true for all of medicine until the development of tests and MRIs and CAT scans. But in psychiatry, we still have these two tools. Sometimes additional psychological tests may be done to assist with the diagnosis, for example, when dealing with intellectual disabilities or learning disabilities. Sometimes when the person is in crisis and the person is not able to provide the information during the interview, the information may be obtained from the family members or others to assist with the diagnosis.
So you mentioned that the physician talked about that the mental health treatment doesn't work. How do we convince common people that there is a mental health treatment available for you and it works? How do we convince our patients?
So that has been the biggest challenge in mental health. And I think that the main cause of that is poor mental health literacy, which means people's lack of understanding of the mental illnesses and the available treatments. And one of the things, most important things that we can do, not the only thing, is education, which is exactly what we are doing by talking to people about this. And then helping them understand, to demystify mental illness. Now people, when they have blood pressure, they are not confused, oh, what is this? But when somebody has depression or these irrational fears or phobias, fear of crossing a bridge, they are puzzled by it, and they feel like they will, if they tell somebody, it'll be embarrassing. They might think, what's wrong with this guy? He's like mentally weak or something.
So typical case of, let's say, depression or anxiety, what should someone expect as far as treatment goes? Let's say the counseling is done, the diagnosis is made, depression, anxiety, schizophrenia, bipolar disorder. What are the typical treatment? Are they outpatient treatment, or someone needs to go to the hospital to get the treatment? What are the common treatments available in 21st century?
There are two broad categories of treatments. One is use of medications, what we call psychotropic medications, medications that help with the mood, thinking, behaviors. and the psychotherapy. Psychotherapy is what conventionally is called talk therapy. Some people refer to as counseling. So there are different categories of medications. We have the anti-anxiety medications, antidepressant medications, neuroleptic medications, and the mood stabilizers. And they help with different types of psychiatric disorders. And psychotherapy can be one-on-one, so individual psychotherapy, or can be done in a group, or marital therapy. And these treatments can be provided when, of course, when the medication is involved, you have to have a psychiatrist. But although 70% of antidepressant prescriptions are written by primary care physicians. But in terms of the therapy that can be provided by any of the trained mental health providers like psychiatrists, social workers, clinical psychologists, and psychotherapy is a more collaborative process. And here it is a little different from the traditional medicine, where the patient goes to the doctor, check my blood pressure, gives you a prescription, you're gone. While in psychotherapy, the individual patient has to be more actively involved in the treatment process for it to work. And generally the treatments in mental health tends to take long, and we live in a world where we want instant relief, and unfortunately that doesn't happen. For example, another point that I want to make is, in fact, that might relate to an earlier question about why people don't seek help. You know, there are people view illnesses as being either curable or terminal. But majority of the healthcare dollars is spent on a third category called treatable. And here, with ongoing treatment, there is improvement in general health, there is improved lifespan and functioning of the individual. And the common examples will be chronic back pain, blood pressure, diabetes, irritable bowel syndrome, or asthma, heart disease, and surprisingly, a large variety of cancers.
Yes.
And mental health, mental illnesses, and treatments for mental illness fall in this third category. So there is no instant relief from these. They take time, you know. And people say, well, how long will I need the treatment? And most of the illnesses, as I described, in practical life are treatable, not curable or terminal.
Yes. So any last word before we conclude this segment today to our patients, our viewers?
I think one of the things I would say is that learn more about the mental illness and understand what illnesses are, understand the available treatments that are there, and then make decisions what to do about mental illness in yourself or your loved one. There are treatments, and treatments do work in mental illness. In fact, in severe depressions, the success rate is 85%. In bipolar and panic disorders, 85%, 80%. And in schizophrenia, it's 75%. So treatments do work. They take time, but they work. And the treatments are confidential. Understand and take action after your understanding, instead of out of ignorance and stigma.
Thank you so much, Dr. Makhija, for your time today to provide the wonderful information on mental health side. I hope our viewers and the patients who suffer from mental health take some advantage from your talk and seek some help, and we all can help our patients, our community healthier mentally on a daily basis. Thank you so much.
Thank you.